worker? Are you
My
working as
medical profession, I would like to combine the influence of social work and the medical profession, and see how
excellent?
best we can help. Yeah, sure.
Very good, very good. So we will wait for others to join quickly so that we
Thank you.
can not lose time. But I would request you today, you, Jimmy, all those who are working professionals, especially Mahmood, I don't know where he is, to contribute. Yesterday he dropped out of class and I didn't get any message from him. But Chipilaro contributed a lot yesterday. Annas contributed. Davis wrote in the chat. So some people are being active. I'm glad about that. Today we have to do the basics of counseling. What,
Thank you.
why, how, why not of counseling. Because we sometimes feel we are all counselors. We have to discuss the difference between giving advice, being supportive, being counselor, being therapist, or just being a friend. Just being a friend, we think we are counseling. These things I want to discuss today through my slides, but I want others to join. I will not, because what happens after some time, then we find people have missed out. Precious was also not online yesterday. Precious Chineri, were you there yesterday in my class? Chineri, how you pronounce your name? Precious. How many of you are working professionals? Working. Other
I'm
than you,
working.
Francis? Yes. So today is the working space. Davis is also working. So working professionals, we are hoping will be able to contribute to today's discussion, last day discussion on leadership and counseling. I'm trying to relate these two topics so that we can form linkages. Because Monday onwards you have different class, isn't it? Somebody, some other course will be there, and this story of human growth, behavior, and counseling will be over today. So before it is over, we need to know what happened. So three people are working: Jimmy, Francis, then who else? Project and program leader for education. Excellent. So you can contribute today, and I will do little recap of yesterday for those of you who missed it, because otherwise you may not be able to relate. We need leaders and counselors in today's meeting, and others I had said that will be the clients. Where is Davis working? Uh, where is somebody else also said they are working, na? Davis. Where Davis, can you switch on your video and share it with me where you are working before I formally start my presentation? This is little catching up with each of you so that you become comfortable in my class. Otherwise, you get bored, then you switch off your video, then somebody goes to sleep. How will we become professional social workers if we are unable to develop leadership qualities? That's our conversation for the day. Yes, Davis, where are you working? I would be happy to know from you. Davis, would you like to unmute and let us know where you are working? Do you know each other, all of you? Davis, Francis, Annas, you know each other?
Good morning.
Good morning.
Yes, I'm working. I work here in the police department, especially in the Department of Community Policing, of which victim support services, child protection, and crime prevention are part of the job. So
Wonderful.
initially, I'm a social worker. Yes, thank you.
So what I've been saying yesterday, you attended my class where I discussed beginning of counseling, beginning phase, why we need counseling services, how can we use counseling services, are we counselors in our respective locations. Let's have begin with a discussion, then I will come to my presentations. Are we counselors? Are we leaders? We are working in senior positions, isn't it? Davis, Francis, Michael, Jimmy, Mahmood, all are working as program leaders or project leaders in one sense. Am I right? Do you in your organization play the role of a counselor? Yes, Francis. What is counseling according to you? Then I will tell you the module definition of counseling.
Yeah, I believe in the basic terms is counseling is more of uh, a guidance skill to help someone relate the environment, his circumstances, his both cognitive, psycho, social needs, and mold them in a way that he or she finds a means to adapt to the society or the environment that maybe the client is perceiving to stop him or her from progressing with a normal life. So to me, that's how I understand counseling.
Very good. Simba, yes, Davis, counseling and leadership. I'm trying to understand your understanding of these two concepts, which I'm going to introduce to you today and take you through. Yes, Davis, please speak.
Um,
We'll be happy to.
yes, I just wanted to share on my views on the counseling. To my own understanding, counseling is a process. It is a process through which a trained professional helps individuals or couples, even groups, to explore and resolve personal, sometimes emotional or psychological problems. That's how I understand about
Very good.
counseling. Thank you.
Very good. Very good. So I want you to contribute subsequently, Jimmy and Simba also. I'm inviting you to contribute. Chipilaro, please, I will be happy to hear your voice and your thoughts. Chipilaro, switch on your
Switch
video
on
at
your
least
video
every
at
day.
least every day.
You are
You are
contributing.
contributing. Hello,
Yes.
am I audible? Yes.
Yes.
Okay. Yes. Counseling. Actually, I'm with Frederick. I work at the Youth Net in Counseling, non-government organization, which empower women, children, and the youth. So I work in the department of helpline, national helpline of Malawi, or which means I'm a counselor.
Okay. You are a
Okay, you
counselor.
are a counselor. Yes, I'm a counselor.
So
So
that means that
that
now
means that
when I am
now
going to
when I'm
share,
going to share,
my voice is
my voice is
sounding twice. Huh?
sounding twice. Huh?
Okay.
No, okay.
So
So
no?
it's
Okay.
fine. No, your okay. Voice is okay. It's fine.
So now when I'm sharing my presentation, I will be asking six of you specially, and Booba is going to take notes because he's going to become a professional soon. So I'm very happy that he has written in the chat, and I will take your feedback as we move along. I want to do some part of yesterday's completion, last few slides which I skipped because they were related to some points I want to discuss now. When I was discussing the basic concepts of social psychology yesterday, I wanted to introduce the role of leadership and role of leader. I believe that social worker is a leader. Anas has written counseling is a professional work. It's a way to guide someone on what he's doing bad to him and inappropriate. Right. So good beginning. Now we will try and get the details from the presentation, and then I will take feedback from you on your understanding of counseling. And finally at 4:30, as I said yesterday, we will make one client. Francis will become client, Davis will become counselor, Jimmy will become counselor, Chipilero will become client. We will do some role play. Is that acceptable to all of us? We will try something online. Is it okay?
Yeah, it's okay
That's
for me.
it's okay, man.
So in the presentation, leadership and role of leader. Leadership is basically a process of social influence in which a person can enlist the aid and support of others in the accomplishment of a common task. All of you who are leaders in the making have three main attributes. You have a position of authority, you are characteristic of a particular person, you're playing a particular role, and there is a category of behavior which you're expected to display as a leader. So what are the behavioral characteristics of leaders? Some are written in this slide. I want you to add those which are missing. So what are the ones written in the slide? Behavioral characteristics of leaders according to our module is that they are intelligent, they have
Are
ability
you
to
are you sh-
dominate.
are you sharing the screen?
Yeah, you can't see the screen.
Yeah, I didn't see the
Yes, it's
screen.
not
Can you
visible,
share it?
man.
We
Oh,
can't
I'm
see
so
the
sorry.
screen.
Can't see the screen. Okay, and now can you see the screen?
No, it's not showing.
Not showing.
Not showing.
Oh,
Sure.
okay, let me try again. Stop
Yeah,
sharing.
yeah,
Now,
that one. Yeah,
now,
now. Oh, it's
no,
coming
it
out.
has gone again.
Gone again. One
Yeah.
Yes.
minute. Present now. Window. This is showing behavioral characteristics of leaders. Intelligence. Can you see it now?
No, it's not showing.
Why is it happening to me?
Yeah, now it's showing.
Now it is showing.
It's showing. So the
Yes.
Yes.
behavioral, okay. So these are the behavioral characteristics of leaders. I want you to discuss about this now among ourselves in the group online. Behavioral characteristics of leaders include being intelligent, having ability to dominate, having adjustment ability, being non-conformist, not necessarily that you will conform to all the rules and regulations. You could question rules and regulations in an organization, maintaining social distance from those you need to lead, ability to inspire others, having problem solving capacity, having emotional maturity, having ability to understand human behavior, having assertiveness, verbal, particularly because you have to communicate with others in the team, willingness to take risks if required, dedication to organizational tasks, and ability to compromise. Now, which of these you think qualify you as a leader? Those of you who are working and those of you who are going to become professionals. How many of these qualities do you have? Can you tell me one by one? Jimmy, then Chakana, then Chipiliro, one by one, tell me. Of these qualities, which you agree with, which you disagree with, and which you think you have. Anybody wants to share their thoughts? This is very important slide.
Okay. Let me just.
Okay.
Am I audible?
Yes, we can hear you clearly,
Okay.
Chakana.
Okay. Let me just intelligent. When it comes to leadership, I remember last time we read about characteristics of the good leader. We talk about
Hmm.
yeah, we'll talk about intelligence, which is most important thing whenever a leader is there. Don't forget that the leader is a representative, can be a representative, or it can be a spearhead.
Hello,
So,
Yamango.
am I audible?
Huh, but words are not clear. You are audible, but your word I couldn't understand. That a leader is what? Huh.
Okay, just try it again. I'll come back. Maybe it's because of microphone.
No, now we can hear you clearly. Okay, by then, Jimmy, you, Cliff, Chipilero, now that you are all last day of my class, each one, please share with me if you think you are a leader, which of these qualities you have, which of these you think are important, and which of these you think are not important. That is what the discussion is going to happen now for 5 minutes.
Hello.
Yes, Supilo.
Yes, I think ability to understand intelligence, whereby you be ability to understand the. Okay, let me go for ability to understand human behavior.
Right. Okay.
As a counselor, we, for example, here in Malawi, we have different tribes, and we have different, of which they have different culture. So each and every culture has its own behavior. So as a counselor has to understand their behaviors, so that it should be in line with the client. Which can end up with in a successful discussion, because once you don't understand one's behavior, it might lead to misunderstanding.
Correct. Correct. Have you finished? You want to say something more, Jimmy? You are next. Please switch on
Okay.
your video, Jimmy. Video you can switch on.
No, my network is a bit poor.
Okay, then you speak. Otherwise, audio is clear.
Yeah. I want to talk about dedication to organizational tasks.
Yes.
I work with more than 100 teachers and 100 schools, and I'm the only project leader for that.
Okay.
But to make things work and also to avoid conflicts where I've used this of dedication to organization tasks is by also training other people in the project to be leaders, by giving them tasks within the uh, project structure. This is
Right.
not something that was defined by the organization, but I found it as a leader to be one of the best ways of making sure that I'm effective and then everyone is effective. So it's a character that a leader need to have, of also delegating tasks to others.
Very good. Excellent. That's very good example. Thank you for sharing. Anybody else who has gone for fieldwork last year, is working? Cliff, can tell me, if you are a leader, you consider yourself a leader, which of these characteristics you think? Leader is one who is treating people equally, and a good leader should have integrity, self-awareness. Very good. Courage, respect, empathy, and gratitude. Yes, Francis, your turn has come now. Thanks, Booba.
Okay, ma'am. I wanted to comment on problem solving capacity.
Hmm.
During my field work, I visited a prison, one of the largest prisons in our country.
Hmm.
So one of the problem that I encountered was as we were discussing HIV/AIDS prevention strategies, I came across that the prison had a number of men sleeping with men. That also was highlighted as one of the challenges by the prisoners, to say we are being molested here. Now, the prison authorities usually didn't want this information to go out because
Absolutely.
it's one it's a public shame that they're failing to control the prisons and the like. So first of all, had to establish the rights. We say, okay, do you have the rights charter for these prisoners? What does it say? Because if you want to confront, or if you want to change, or if you want to advocate for a social change, at least you must know how the basic structures operates before you come in. You cannot advocate for things you don't know, or the things you don't understand. Now, it happened to say that within their charter, it highlighted some of the basic rights for these prisoners: right to health, right to care, right to food, right to security, and others. So I had to dwell on those points that were part of the system already, to say, okay, according to your own rules, it appears that you're not following rule number 5, number 6, number 7, and number 8, which has also come out as an infringement to the problem that we are seeking to address here. So
Hmm.
I believe that should be one of the major characteristic or behavior characteristic of a leader when dealing with problems. First, you have to establish what is it that the people know, what structures do they have, is the problem amongst there are already prescribed rules or norms, or it's a new phenomenon to them, so that you should be able to tackle that differently. Yeah, so here I wanted to relate that to say problem-solving capacities and abilities
Very
should
good.
also include, yes, it should also include the technical know-how on the subject being addressed, because you can't be a counselor in HIV if you don't understand how HIV is spread, how HIV affects the globe and the local
Yes.
communities. You cannot be a counselor in finances if you're not good at finances. The English, the English 135 had included that some bonds. It had some financial concept from the start of the semester, which introduced us to how finances align. So it's the same. If you want to talk about culture, you have to know the diversity of culture amongst the society. If you want to talk about marriage, then you have to know, must have the basic understanding of the marriage institutions. Therefore, you can come in as a leader and as a counselor. So yes, it is one of the best points within the behavior characteristics of a leader, to have a capacity to solve problems. Yeah,
Very
thank
good.
you.
Thank you. I will come back to you, Francis, when we do the role play. I'll read what Jimmy has written for all of us, and then Cliff will speak his mind, and then I will proceed with the presentation. Jimmy has
Can
written
I,
that leadership.
can I,
Chakana.
yeah, right. Uh, I think I'm audible. Just
Yes,
want,
you're audible.
yeah, I just want to share more about the leader. Who is the leader? Actually,
Yes.
is somebody whom people follow.
Respect.
Like, yeah, any decision can be made through him or anyone, right? So,
Okay.
I have some few things to share with you. Leadership has to do with communication, right?
Hmm.
Of which,
Right.
so there, yeah, he's supposed to communicate. He's supposed to be a good communicator to the subordinates, right?
Hmm. Right.
Integrity. The leadership should be a leader supposed to also have an integrity. I don't know if this is also considered in this body. Hello,
What is your question
I'm
about
asking.
integrity? Ah,
Yes, integrity. Yeah, it also has to do with the intelligent. Yeah, that's especially should be emotional intelligent. That means you should take everything seriously to what is
yeah,
considered.
correct.
And then it's supposed to be a confidence. A leader
Confidential.
supposed to be, yeah, confidence when
Uh-huh.
it comes to
Good.
work. This is what I suggest. So I haven't introduced myself. Actually, I'm working with Old Mutual as a financial advisor. I used to go in different fields, and I had to share with the people, especially on the financial education.
Okay.
Uh, yeah, something like that. So I am happy with this field because it's a part of social work when it comes to advising the people. Because my work also has to engage with communities,
Hmm.
looking into it. So I have to also to discuss some few things on how they can plan on the retirement, pension schemes and something like that. So this is
Okay.
what I have. From there, I was also working with the Samaritan Trust as a social service officer, and there
Uh-huh.
I've been working for some years, and I've discussed some few things with the community, especially this organization who has to do with street connecting children.
Hmm.
Yeah,
Okay.
so we have to try transform the street children, and they're supposed to go to school, maybe to do some vocations,
Hmm.
something like that. Yeah,
Okay.
that's what I actually do.
Very good. That's very nice that
Yeah.
you are sharing your work experience with us, because we are coming to the more complex part of counseling. After listening to Cliff, you want to say anything? Chakana, have you finished?
Yes, I'm done.
Okay, done. Now, Cliff.
Yes, Mama.
Yeah,
Good morning, madam.
good morning.
Yeah. Um, Yesterday I wasn't able to attend the classes. I experienced a problem in my network here. So
Hmm.
today I think I'm able to attend this class.
Okay.
So to begin with, I would love to take ability to inspire others
Hmm.
as a leader. Hello, can you hear me, madam?
Yes, ability to inspire others.
Yes, ability to inspire others as a
Hmm.
leader. Yes,
Hmm.
I understand the leader as someone who always influence others,
Hmm.
unlike the manager
Hmm.
who only focuses on how things are getting done.
Hmm.
So in this case, as a leader, uh, I will be able to inspire others
Hmm.
um, so that they can also be able be leaders. They should see something in me that will make them get inspired and become a leader. Maybe through my, 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 my,
Creating
my
a
actions.
second
Through
line
my
of
actions.
leadership. Yeah, correct.
Yes, yes. Yeah, so it might be how I communicate with others,
Hmm.
transparency and accountability. These are some of the things that can inspire others as a leader.
Hmm.
And
Very good.
also how we understand a human behavior,
Hmm.
how we can
Hmm.
understand someone in terms of problems that the person is facing or is
Yes.
challenging. So as a leader, he has also to identify and know the kind of problem the person is
Very good.
encountering. So as a
Hmm.
leader, I understand that he has to influence others to do the work
Correct.
efficiently.
Right.
So that's how I can share.
Very good. Jimmy has also differentiated between being a leader and a manager and raised his hand. So we will hear Jimmy first, then Chaima, then I will proceed. We are reading Joanne's comments also in the chat. Jimmy, it's
Yeah,
your turn
Oh,
now.
so
yeah, I wanted to agree with the Cliff that a leader should be someone who can inspire others, and inspiring
Hmm.
others means that you need to lead by example. At the
Hmm.
same time, um, you should be someone who can also learn, because being a leader, you don't know, it doesn't mean that you know everything. So you can also
Absolutely.
inspire others when they know that you are so cooperative and you are also willing to learn. A leader should be someone who is also a lifelong learner. So in
Very
the
good.
process of leading, you should also be someone who can also listen to the team. It should not be done until you have also understood what others are raising, and then you keep on learning and leading with everyone also getting inspired from you.
Okay. Very good. Thank you. Yes, Chaima, what do you want to say?
Yeah, first of all, I have just to apologize that I've come late, and I don't know if this point already explained to someone. Confidence, a leadership must have a confidence.
Hmm.
Um, in order for your client to believe in you, you must first believe in your own leadership abilities.
Right.
That's why confidence is a key. To
Hmm.
build your confidence or report positive affirmations to yourself. Also, practice good postures, speak
Hmm.
clearly, and make eye contact while speaking. It's easier said
Correct.
than it's easier said than done, but with good practice and repetition, your confidence will grow up and your client will notice something from you. Thank you so much.
Hmm.
It's what I was trying to share with my friends.
No, you didn't join late. We today started late and started discussing leadership qualities, and I'm glad that we started from this, because some of you were missing yesterday, and I skipped 4 slides because I wanted to complete this on leadership and then proceed to counseling. Yes, who has raised their hand? Now we can listen to that person who has raised the hand. Who wants to speak now? Yes, Michael Simba. Please go ahead. You want to switch on your video? Oh.
Good afternoon, ma'am.
Good afternoon. Please go ahead.
Yeah, from me, I would like to explain more about the adjustment as the law of the counselor, as well as the social worker. Because an adjustment, I understand that it's a process whereby an individual should have to involve himself in adapting or managing, or rather cope some changes that might come on his way. So, as it is an I work kind of professional whereby somebody will be meeting or having involving some other people, different types of people, kinds of people with different types of culture, behavior, belief, and whatsoever. So there is a great need for a counselor to have a spirit or a law, or to understand how to adjust he himself. Because wherever he goes, he will meet some other people with different types of culture, different types of behavior that you couldn't be expected to meet with. So he's essential or inappropriate for him to have the spirit of the law or to understand how to adjust himself. Because
Very good.
the work of the cancer is a leader to teach or even to help some other people or individuals who have been involved in psychological, emotional, or whatsoever problems to adjust to the certain changes that might come on their way. Thank you, ma'am.
Thank you. Okay, now Francis has asked this $1,000,000 question: empathy versus sympathy, should they go together? I was coming to that subsequently when I would come to counseling. When we empathize, what happens, and when we sympathize, what happens? We will come to this. I will, when you do your role play. I'm coming to that by 4 p.m. But please think about it. Empathy versus sympathy. What is the difference? If I'm crying along with you when you're crying, or if I'm saying I'm understanding your pain, but I'm not sitting there and crying, but I'm trying to help you to find a solution, then I'm empathizing with you. If you are upset, I'm also upset, both of us are upset, and we can't take the next step, then that is not a very professional attitude, and then that is only being sympathizing. I sympathize with the victims, I sympathize with where this landslide happened, I sympathize with all the deaths in the COVID, but I am unable to do anything to help. If I'm in a position to help, reach out, means I'm empathizing. I'm putting myself in the shoes of the other person and then keeping my head on my shoulders and deciding what to do. This part we will come to in some time. And as some of you mentioned, the roles played by leader are also listed in this slide. Can you see this slide? Next slide.
Yes, yes.
Leader as a planner and policy maker, leader as an executive, executing tasks, leader as an expert, leader as a representative, leader as deciding reward and punishment for his team members if they are not able to deliver and there are some deadlines to be met, leader as a controller of external relations, leader as a role model, leader as a symbol of the group, leader as a substitute for individual responsibility in case somebody cannot meet their own responsibility. He tries to substitute for that person in the team. Leader as an ideologist and leader as a scapegoat. Anybody finding anything strange in this roles played by leader? We can take few minutes and flag it before moving to counseling, the last unit, as I said. What is scapegoat? And what is leader as an expert? Little bit you discussed just now. Scapegoat, what is the meaning of scapegoat? See in your language. Francis. and take the blame.
A scapegoat, it's whereby a leader is almost like a leader taking taking the burden of the group or taking the burden of the organization. Yeah, it's
Or
more like
something
that.
going wrong.
Yeah, exactly. When something is going wrong, a leader has to stand up to say, no, we meant good. We are going into this. If there is anyone to blame, you blame me because I'm the one who was caused this. And that is my understanding on a scapegoat.
Anybody else? Roles played by a leader. Because I'm moving now to the last part, as I said, on Jimmy. Counseling I'm moving to. After hearing Jimmy's reaction.
Yes,
Scapegoat is
the way, the
what
way,
has to
the
take
way I
first.
look at a scapegoat is to me it's a lame excuse. You are supposed
Ah,
to take full responsibility of something, and then you bring in an excuse for people maybe to feel pity of you while you are supposed to take the full responsibility.
this is a different, this is what Jew said and Francis said. This is just difference in perception. You know, we perceive things differently or we use different terminology. Also, difference in ideology. What is ideology? Way of looking at the world. Ideology is way of looking at the world. Difference in ideology. That is a bold statement which Jimmy made, that we don't need to become a scapegoat. We take responsibility. But what Francis was trying to explain is that if something goes wrong, if the blame has to be taken, then the leader says that no, I'll not blame any of my team members. I am to blame because I am leading the team. That is what I understood from Francis. But I look at this as difference in ideology and difference in perceiving. Now I am coming to counseling services. The uh, last unit which this is closed. Can you see this present now? Counseling. I had discussed basics of counseling yesterday. Can you see the slide? I'm doing revision for 5 minutes. Can you see the slide? Oh, now it is showing.
Yes, it is showing.
I'm doing revision for those who missed it yesterday. I covered yesterday the objectives of this unit, last one. I have to go a little fast because I have to finish it today by 5 o'clock. But I have done 10 slides, which I'm revisiting today for those of you who missed it, because if I come to the 11th slide, you won't understand. So the objectives are nature of counseling, difference between counseling and psychotherapy, disorders for which counseling is not the best therapy, general characteristics of a good counselor, which we had some debate about yesterday, and characteristics of a good client. So the 5 units in the last module are as follows. Unit 1, Introduction to Counseling. Unit 2, Processes involved in counseling. Unit 3, Supportive and Behavioral Techniques in counseling. Unit 4, Cognitive and Psychoanalytical Techniques in counseling. And Unit 5, Practical Issues involved in counseling. I started with Unit 1, defining counseling as a provisional of professional assistance and guidance. It requires a client and a counselor. It is the act of helping the client to see things more clearly, and it is built on a relationship of trust. The important goals of counseling are as follows, covered yesterday as well: to help reduce the emotional distress of a client, to help reduce the dysfunctional behaviors of a client, to promote better adaptation of the client to his or her environment, to assist the client in making important personal decisions, and to enhance the self-determination of the client. Counseling is not merely just giving advice like a friend, a parent, a neighbor, a brother, a sister, a sibling. No, it is, we even discuss principles, including being non judgmental. So, counseling requires that we don't be judgmental. It attempts to sort out the problems of the client. It is not necessary that we can have an expectation or encouragement that the client has to, we are expecting or encouraging the client to behave as the client would behave if confronted with a similar situation. So we can't tell the client, when I was your age and faced with this situation, I did this. So you should do this. No, it doesn't work like that. We can't get emotionally involved with the client. It is not acceptable behavior. And looking at a client's problem from your own perspective is not correct in counseling. Differences between counseling and psychotherapy were also highlighted in terms of this table. Counselor has short-term solution for present issues. Psychotherapist has long-term solution for recurring problems in a client. Counseling is action and behavior focused. It focuses on the action of the client and on the behavior of the client. Psychotherapist focuses on the feelings of the client and is experience focused. Counseling is a secondary process. Psychotherapy is a primary process. Counselor offers guidance and support. Psychotherapist undertakes talk therapy, and there are other therapeutic strategies undertaken by psychotherapists. Then we discussed yesterday characteristics of a good counselor, which we revisited just now by talking about leadership qualities as well. That counselors are required to have good communication skills, be patient, have confidence, be non judgmental, be observant to the client, his body language, his behavior, have innate listening skills, build a level of trust with the client, which may take time, be respectful and receptive to the client, acceptance, be self aware of his own strengths and weaknesses before dealing with the client's strengths and weaknesses, be appreciative of diversity, and be empathetic, which you just now raised. Empathy versus sympathy. So, counseling cannot occur if there is gross abnormal behavior. We need to refer to psychotherapist in that case. If there is abnormal behavior, if there is presence of delusions in the client, if there is presence of hallucinations in the client, if client is suffering from obsessive compulsive disorders, these are all serious mental health issues to be dealt with by the psychotherapist and not the counselor. If there is loss of judgment in the client, if there's severe abnormal mood swings in the client, we need to refer to the psychotherapist. So there are several disorders, however, which are likely to benefit from counseling. Counselor is very good when it is dealing with the various forms of depression in client, where they are dealing with anxiety and anxious clients, disorders where there is failure to adjust with recent distress or long-standing distress of clients. Counselor is the best person to go to. Any conduct disorders, behavior disorders, emotional disorders of childhood and adolescence taken up by school social workers and mental health counselors, counselor is the best. And last but not the least, most kinds of interpersonal problems, substance abuse, alcoholism, or drug abuse are best dealt with by trained counselors. So, what are the communication skills of a good counselor? Just as we discussed a while ago about leadership qualities, a good counselor should be conscious of his or her body language, should be able to listen more than talking, should be polite, courteous, and tactful in dealing with clients, should be clear and unambiguous in communicating with clients, should not give mixed messages, should encourage the client to speak and share their problems, issues, concerns, should have a positive frame of mind and should communicate that in communicating with the client, should converse in such a way that he or she displays that he's inquiring, he's interested, he's summarizing what he's understanding, he or she is encouraging the client to express their thoughts and feelings, and also knows how to handle the silence of a client if it comes up. That completes unit 1 of counseling, which we did yesterday. But I revisited it for 5 minutes for those who need to understand where we left off yesterday Coming to Unit 2, processes involved in counseling. This is a fresh topic for today. The initial interview with the client enables the counselor to know the client, to know the client's conditions better, and to enable the client to know the counselor better. It offers the counselor the opportunity to explain the goals of counseling, the purpose which he is trying to achieve by undertaking counseling, and it is the beginning process of understanding and accepting one another. This is in the initial interview with the client. Our goals are as follows, which I have just written. When we came to the second stage of assessing the client's problem, it includes assessing client's psychological framework, his or her problem situation, what issues they are confronted with, obtaining information from others, extended family members, siblings, neighbors, friends, teachers, and from the client's environment. All this constitute part of assessment of the client's situation. The middle stage forms the bulk of the period of counseling and includes assessment, moves beyond initial interview and includes assessment, diagnosis, and problem solving. The termination stage or the last stage includes problem solving and follow up, that whatever suggestions were given by the counselor to the client, has he or she been able to follow that? Have they had any relapse? Is there any need to follow up? Any follow up sessions are required? All that is the termination stage. Going in further, little more detail in the initial interview, please note, can you see my slide on the points for initial interview? The counselor needs to make a statement of the problem of the client. The statement of the problem has to be clear and unambiguous, simple, straightforward. Systematic evaluation of the problem has to be spelled out in the written notes of the counselor. What is the counselor's understanding of the cause of the problem of the client and the effects it is causing on the client's moods, feelings, thoughts, actions, and behavior? Why is the client in a circular loop of not being able to come out of his problem? The counselor needs to identify that loop. She should be in a position to take feedback from the client that what he is understanding is what the client is expressing. So he has to paraphrase what the client is saying. And evaluation of the client's motivation for counseling has to be assessed in the initial stage of counseling. Clarification of expectations of the client has to be understood by the counselor. It has to be reinforced to the client. Setting of goals of counseling have to be spelled out. It is a position of establishing a contract between the client and the counselor and making practical arrangements for counseling, a safe space, a safe cabin, a safe corner of a room where confidentiality can be maintained. Nobody is going to overhear you. Nobody can see you through some small hole in the glass window. The client should not feel uncomfortable that this place has been chosen for counseling. All these become integral part of the initial interview. The next stage, as I mentioned, the middle phase, is the phase during which the counselor analyzes the client's feelings and behavior, provides feedback, support, and guidance to help the client to change his or her behavior in due course of time. I'm going to take examples from you in half an hour after I complete this, from your field experience and from your work experience. But first, I want you to see these slides and make notes so that you know what we are talking of. Are we talking of the initial stage, initial interview, the middle phase, or the termination phase? So I have completed the initial interview phase. I'm coming to the middle phase where the counselor attempts behavior change in the client. While attempting to enable the client to change his or her behavior, three major factors need to be kept in mind as are depicted in this slide. First, what are the emotional factors which require correction in the client to help resolve or reduce his dysfunctional behavior. What emotional factors? Fear, anxiety, dissonance, distorted thought pattern, insecurity, any of these emotions, which are those, you have to identify them, which is stopping the client from helping him to resolve his dysfunctional behavior. Second, any faulty ways of thinking which need correction. My brother is my enemy. My father always hated me. My parents always loved my older brother more than me. My teacher has always supported the next boy in the class. All these are faulty ways of thinking when we start investigating the issues of the client. And last but not the least, the social and the environmental factors which need to be addressed in the client. This is the middle phase. From the middle phase of counseling, the counselor, with his experience, knowledge, and understanding, moves to the termination of counseling. When can we say that we have completed the counseling process? And what are the stages of the termination of counseling? When can we say that we can terminate the case? The can be closed. We can notice that the stages of termination are as follows. One, evaluating the readiness of the client for termination. That means initial interviews are over, middle phase has been successfully completed, you have enabled the client to correct his faulty ways of thinking, you have enabled the client to see that his emotions are steady and consistent, you have enabled the client that his social and environmental factors have been addressed. Only when these processes are complete can we say that the client is ready and the counseling case is ready for closure. So we need to evaluate readiness of the case and the client for termination. Second aspect in this is that we need to provide advance notice for termination. Once we have enabled the client to resolve his or her problems, 5-6 sessions of counseling are over, 10-12 sessions are over, depending on the case. The client needs to know that only 2 more times he needs to come to the counselor, and after that the case will be closed. So we need to give advance notice. We can't suddenly say today is the last day, I'm not going to see you anymore. The client is not prepared. The client doesn't know whether his problem has been solved. Counseling is a gradual process. So advance notice needs to be given. Proper planning needs to be done by the counselor. Adequate notes need to be taken. Adequate communication needs to happen. And readiness for termination needs to be deciphered and discussed with the client before closing the case. If the client is going to be referred for psychotherapy or further therapy, we need to review the case. We also need to emphasize on the client's role, that further on from now, you have to take responsibility for yourself, dear client. So how do we arrive at that situation is what we will attempt to do in some time, by making one of you a client and one of you a counselor. So effective adaptation is a must for a counselor. The skills and the experience of the counselor are called to play, and the client has to be given that bandwidth that in case you need to come back to me for follow-up sessions, you are welcome. Through phone call or email or communication, you can definitely seek appointment and come back to me. But the final call for you to resolve your problems in future is yours. That kind of communication has to go to the client. Am I clear so far? Before I proceed, I just want
Yes,
to
ma'am.
take a call.
Very good, madam.
Yes. So, going further ahead in this very important last module, Unit 3 talks of supportive and behavioral techniques in counseling. What is supportive counseling and what is behavioral counseling? So, this unit helps us to understand how to reduce the emotional distress that the client may be experiencing, how to reduce the dysfunctional behavior that the client may be manifesting, how to promote better adaptation of the client to his or her environment, and how to assist the client at arriving at important personal decisions. The supportive techniques in counseling are as follows. Supportive techniques means what? Supportive from the very term indicates that we are able to measure the comfort of the client in taking help through supportive measures like ventilation, speaking out, ventilating his or her concerns, ventilating his thoughts and feelings, catharsis, if the client needs to cry or feel upset, we don't get upset. We allow the client to feel upset in our presence. Clarification, if the client wants to explain something, I did this because of that, I did that because of this, we give them the space to do that. Education, we as counselors need to educate the client if they are having some wrong notions about their siblings, family members, situation, about themselves. Guidance, suppose they do not have enough guidance, that's the role of the counselor. As a leader, the counselor provides guidance. Sometimes we may need other supportive techniques like environmental manipulation, prestige suggestion, no, you are good enough, you can do it, and externalization of interests, how to motivate the client to develop interests and hobbies beyond what he or she is doing, encourage them to do pottery or gardening or take interest in other activities which are available, farming, depending on the situation of the client. The supportive techniques, again, I am putting in the table here, and I want you to read about it and discuss it when possible. Ventilation, environmental manipulation, physical exercise, catharsis, prestige suggestion, meditation, clarification, externalization of interests, education, guidance, pursuing some other pleasures, going for movies or going out, utilization of social support from the family or friends, medication if required, and last but not the least, prayer. So, some of these supportive techniques you may find we may not be using, but we may have to analyze the situation, individualize each client's situation, and decide which combination of techniques we are going to use between interview stage and treatment stage in providing support to the client to enable them to solve their problems. So, going back, what comfort or guidance can we give to the client in this, from this package basket? It's like a basket from which you have to choose through your discretion as a counselor how and what supportive techniques you will provide to the client depending on his or her situation. The behavioral techniques is the second major component of counseling. Behavioral techniques include problem solving, rehearsal and role play, and contracting. Problem solving, of course, you are all familiar with. You have mentioned it in some of your narratives in fieldwork and work experience, how you have enabled people to solve their problems. But what does rehearsal and role play mean? Behavioral rehearsal, rehearsing behaviors. Suppose you tell the client comes to you and say that I have a very bad relationship with my elder brother or with my father or with my spouse. You, after preparing the ground, building the trust, maintaining confidentiality, enabling the client to believe in you, arrive at a situation where you may enact a role play, do a rehearsal that suppose I am your elder brother and this is the situation. Now speak up. What I was trying to tell you, that at 4:30 we will do a role play to practice the skills and techniques which are going to be applied later in life. Suppose he says, I'm going to get married, but I'm not prepared for marriage. I'm afraid of how will I adjust with my spouse because my parents have always looked after me. My mother has always done the cooking for me. My mother has always done the clothes washing for me. Now I have to share responsibility with my spouse. We can enact a role play. By providing objective feedback to the client, we can enable them These are called behavioral techniques in counseling. The third behavioral technique is behavioral contracting. Behavioral contracting is an intervention used by schools to help monitor and change student behavior. Using a simple contract, the expectations of an individual student or class are spelled out, and adult responses or expectations are also spelled out, making it a useful planning document. It's like a contract between a student and a parent, a contract between a student and a teacher, a contract between a student of a lower grade and a higher grade. And behavioral techniques are used. Again, these are all technicalities which you will learn and study in due course. But to introduce you at the BSW stage, it's important for you to know that there's something called behavioral techniques, and the behavioral techniques are as follows. There is something called supportive techniques, and the supportive techniques are as follows. If I mention to you, then only will you go and try and read up more about these techniques if you really want to become good counselors. I want to stop here for 2 minutes before I move ahead to further explaining to you professional ethics by pausing to understand from you that in your counseling that you may have undertaken at any stage in your working life, or if any of us, as I asked you yesterday, have been part of a counseling session, did we see or experience any of these techniques being practiced? Any of these techniques being practiced? Or are we reminded of any of these techniques we may have heard of, or we are familiar with, or it is reminding us of some instance which may have happened in our school, in our college, in our neighborhood? I would like to take a response before proceeding, because this is a very essential part of counseling and the techniques used in counseling by trained counselors and social workers. Can I get any response from any of you who are working in the field, who are having job experience of 5 to 10 years? That have you undertaken counseling during COVID times? Have you seen counseling being undertaken by any of your seniors, any of your team leaders in your jobs? Francis, Chakana, all those who were giving me examples, I am happy to take your response at this stage. Or have you gone to have cup of tea? Not seeing anybody. Cliff, Dente, Francis, please switch on your video.
Okay.
Yes, thank you.
Yes, ma'am. Yes, I wanted to comment on supportive and behavior techniques to say
Very good.
we have seen a lot being happening. For example, I'll give you an example in the ART section where sometimes I work. We do conduct ART clinics. I also get involved in palliative care medicine, whereby we counsel clients in the end life care, pain reduction, pain management,
Yes,
using medicines and other measures.
yes,
So maybe we didn't have that language. You say contracting, for example, to say okay, this is what we're doing is this, because in the medical curriculum it doesn't talk much about counseling, the skills that you learn on job.
right.
Yeah, so yes, so I'm seeing a progress, I'm seeing a flow now, to say okay, I think this is related to this is related to this, and I think now we have a language for what we have already been doing in the system. I believe is the same
Wonderful.
with our friends. For example, I was commenting on the police officer who is here.
Yes.
One of the days I had a road traffic offense. I didn't put on the helmet while I was sliding a motorcycle. So I was stopped by the officer to say, okay, you're a medical profession. You care for your life. Why is it that you don't want to care for your own by
Yes.
not putting on a helmet? So I
Right.
found it very interesting to say, okay, I think this is a good way to tell me to say, no, please put on a helmet, rather than say, okay, go there, pay a fine, and being penalized. So
Right.
I'm just happy that I'm seeing the flow to say, okay, now we can relate what is being taught here, and now we have a language for what we've been
Exactly.
actually doing. We've just been doing
Very
it
well.
out of professionalism, but now we are able to say, okay, now I'm a professional. I have to do it differently in a
Yes.
chronological order according to,
Yes.
to, to what we are learning here. So that's what I wanted to say.
Very good. I'm very happy. Cliff,
Thank you.
Chipilero, Anderson, who else? Would you like to contribute here from your experiences? I'm glad that some discussion is taking place. Simba, Manas, Yuan, anybody with any examples from the field? Because this is called linking theory with practice, learning from the field. And whatever we are learning from the field, we are able to relate it. That if we are going to become counselors, what does it require us to do? What techniques does it require us to follow? What skills does it require us to learn and practice? Are you there? Or you have all gone after putting on audio online? I'm waiting for some responses from Chakana and Simba, Anas, Jente. Are you there? Because we have to have that role play online. Remember, yesterday we have discussed, but I think you are not there. So I will proceed then with the presentation if nobody wants to contribute. By talking of professional ethics,
Before you go further, can I come in?
yes, Chipilero, please go ahead.
Okay, I think one of the ethics for professionals is like respect for fellow professionals. You
Yes,
can go
yes.
to a field whereby you have different professionals.
Mm-hmm.
So you have to respect each other
Mm-hmm.
because you are in the field another. You find out that when you are in the field, you find someone is a financial manager. You have to
Mm.
respect his or her skills, and you gain something from it, of which it will help in your professionals one day.
Mm-hmm.
Thank you.
Thank you. Anas, I wanted to hear your opinion also, and then I will wait for Simba and Chaima and Cliff Malta before proceeding. Anas, are you there?
I'm coming, ma. I'm coming.
Okay, come. So, the professional ethics talks of confidentiality, respecting the right to privacy of the client, respecting the gender identity of the client, respecting the profession of the client. We cannot assume that the clients are all coming who are uneducated or illiterate. We may have some professionals seeking help. We may be having some professionals from some other space requiring the help of counselors and social workers. So we need to respect the profession and their backgrounds. We also need to be careful that we are not probing unnecessarily. We only ask those questions which are required, which means, as a counselor, we need to have discretion about what is required and what is not required. That comes with experience and understanding. There has to be an appropriate time and place for conducting the interviews, respecting the freedom of the client to express what he or she wants to express. On day 3 or 4 of counseling session, we can't say to the client that you could have told me on the first day. Why did you tell me now? You took so long. He is not my friend or family. He is a person in need and he has a right to disclose what he wishes to disclose when he or she wishes to disclose. That element of sensitivity we need to develop as a counselor and a social worker. What does it mean to be respectful? What does it mean to be accepting? What does it mean not to create unnecessary dependency of the client or the counselor? Unnecessarily, we cannot prolong the counseling sessions to prove that you are a good counselor. That is not the plan. So, unnecessary dependency should not be created by the counselor in any way. So far, sorry, after completing unit 1 and 2, we need some key words which are there in the module, which I have purposely brought out in this presentation for you to look at, study, reflect on, and understand. What are the key words? We talk of counseling and the techniques of counseling. So, techniques of counseling means what? Methods used to achieve the goals of therapy. What are the methods, supportive or behavioral techniques, we are going to be using to achieve the goals in the therapeutic situation for which the client has come to us with a problem? That is the meaning of techniques of counseling. The second key word is eclectic counseling. Eclectic counseling is a term which describes the counseling of clients using techniques derived from different schools like psychoanalytical school, behavioral school, other schools. So you need to read a little more about that in the module. That is called eclectic counseling. The third key word which I used when I was talking of supportive techniques, if you noticed, was ventilation. What does the term ventilation mean? Ventilation is a supportive technique wherein the client is encouraged to talk about his or her problems freely. Freely. We cannot disturb and disrupt saying you are repeating yourself. Freely they are in a position to talk. That is ventilation. The next key word is catharsis. Catharsis again is a supportive technique wherein the client is allowed to let his or her negative emotions flow freely. Negative emotions can be in any form. They may express itself through fear, through numbness, through crying, through clamping up, to becoming silent, to speaking too much, to being repetitive. We need to have the patience and professionalism to accept catharsis as a supportive technique and to encourage it in the client where required. The next key word is clarification. Clarification is another supportive technique wherein confused thoughts in the client's mind are sorted out. The confusion in the client's mind is sorted out so that it helps him or her to understand the why and how of what he or she is feeling and the why and how of his or her reactions. So, these are very important keywords which I have highlighted for you in this module. I have also brought you on to some more keywords which I have used earlier, but I'm repeating it and highlighting it again now. The next key word is guidance. Guidance is a supportive technique again, where practical advice is provided to a client by a counselor during therapeutic sessions, depending on his or her situation. It is an individualized program. It's not general guidance, it is specific guidance. The next key word is prestige suggestion. Prestige suggestion is another supportive technique where positive attributes and behaviors of the client are highlighted. We have to find the strengths in the client, the good parts of the client, not only the negative attributes, and reinforce the positive attributes, appreciate the positive attributes, enable him or her to enhance his self esteem. That all these constitute part of prestige suggestion. The next key word used here is environmental manipulation. Environmental manipulation is a supportive technique, again, which enables the client to enhance his self esteem. Changes are made in the client's environment to help him or her reduce his distress level, to help him or her reduce his stress level, and to facilitate his or her adjustment to his surroundings, to his environment, enabling him to get back on his feet, to get back on track, enabling him to address his issues by himself in due course of time. And last but not the least keyword is externalization of interest, which is again another supportive technique where client is encouraged to take up activities, hobbies, which divert his or her attention and does not only focus from his stress and distress. We encourage them to go out, do outdoor activities, or engage with friends, or go hiking, or go and see a movie, or undertake meditation or prayer. There are many ways which this supportive technique can be used, called externalization of interest. Now we come to unit 4 of this counseling module called cognitive techniques. So far, I have covered supportive techniques and behavioral techniques. Now I'm bringing you to cognitive techniques. Cognition is to do with the brain, the mind. Cognitive behavior therapy aims to change our thought patterns, our conscious beliefs, our unconscious beliefs, our attitudes, and finally our behavior so that we are able to face difficulties and achieve our goals. It was developed by psychiatrist Aaron Beck, who was the first to practice cognitive behavior therapy. Like most mental health professionals at that time, Beck was a psychoanalysis practitioner. Cognitive distortions are internal mental filters or internal mental biases in any client's mind which fuel anxiety and make us feel bad about ourselves, make us feel small, make our self esteem low. These mental filters can cause us to brood, to feel small about ourselves, to speak ill of ourselves, and worsen. It can worsen by depression or anxiety. And therefore, it requires that the counselor undertakes positive lifestyle changes, encourages the client to undertake positive lifestyle changes if we want to use cognitive techniques as a therapy in counseling. I have used the word intrusive thoughts in this explaining what is cognitive technique. I want to dwell on intrusive thoughts a little bit before proceeding further. Intrusive thoughts are thoughts which affect 6 million Americans, not documented in India and Africa. But in America, it has been documented that it has impacted 6 million of them, according to a study done by the Anxiety and Depression Association of America. Intrusive thoughts are associated with mental health disorders, such as obsessive compulsive disorders, where thoughts become so bothersome that we are doing repetitive behavior and we cannot prevent them from occurring. I don't know, have noticed some people constantly wash their hands. Open the door, go and wash their hands. Go to the kitchen, again go and wash their hands. Open the laptop, again go wash their hands. So some obsessive compulsive disorders are coming as part of intrusive thoughts, and we are not aware that they are repetitive behaviors. They are not in our control. And it is caused either by post traumatic stress disorder, by some life threatening experience which has happened, by some stressful events which have happened in our life, by some trauma which has happened in our childhood, any accident or violent attack. Many people who experience these thoughts don't have a mental health disorder. That is what Dr. Kerry Ann Williams says, who's a lecturer in psychiatry at Harvard Medical School. But for many years, obsessive compulsive disorders were labeled as abnormal in the textbooks of abnormal psychology. So, intrusive thoughts are often triggered by stress or anxiety. They may be a short term problem due to a biological factor or a hormonal shift. A woman might experience something after childbirth. These are all examples of intrusive thoughts, which also brings us as counselors and therapists and social workers to understand the concept of self esteem, which we have been dwelling on for the past 2 days. What is low self esteem in any client? Low self esteem refers to a person having an overall sense of self value which is poor, poor sense of self value. I think poorly of myself. I think I'm not good looking. I think I do not have good communication skills. I think I will not become a good social worker. I think I'm not a good sibling. I think I'm not a good child. I think I'm not a good spouse. It could be any of these. It means having a poor opinion of yourself. Low self esteem can result from a range of factors. Maybe my sense of identity, which I have since childhood, my self confidence, my feelings of competence or incompetence, or my feelings of belonging to the family or the neighborhood could trigger low self esteem. So, self esteem is about more than just liking yourself. It means believing that you deserve love, valuing your own thoughts and feelings, valuing your own opinions, having confidence in your own interests and goals. It can also play a role on how you allow others to treat you. Having self esteem not only impacts how you feel about and treat yourself, but it can affect your motivation to take on a career. It can affect your motivation to do something in life. It can affect your ability to develop healthy, supportive relationships in life. It plays an important role in a variety of areas in life, which is why having low self esteem can be a serious problem, and we need to address it in ourselves or in our clients. I hope the concept of self esteem is clear to you. This brings us to the fourth major technique in counseling called psychoanalytical techniques. Psychoanalytical techniques will help you by reminding you what we discussed yesterday and day before about defense mechanisms and the details we studied about defense mechanisms. Because it is from those defense mechanisms that we are going to derive the psychoanalytical techniques for counseling. So, defense mechanisms, if we recall, are behaviors that people use to separate themselves from unpleasant events, actions, or thoughts, like denial, suppression, repression, projection, intellectualization. The mature defenses, in contrast to defense mechanisms, are defined by a healthy and conscious relationship with reality. Reality is accepted even when it is not appreciated. That is maturity. Uncomfortable feelings and thoughts are transformed into less threatening forms by a mature individual. It is the ones who are using more defense mechanisms that they tend to push them aside by denial or repression or projection or intellectualization. If we are mature in dealing with our defenses, if we are mature and maintain healthy and conscious relationships with reality, we need to understand that we can decide and choose to cope using mature defense mechanisms. This doesn't happen spontaneously. We have to train ourselves. We have to train ourselves to use mature defense mechanisms. What does that mean? Giving the example of suppression as a defense mechanism is a conscious form of repression. You choose not to engage. I don't feel like talking about my distressing feelings or thoughts. And you are afraid. So you are aware of your distress. You're aware that you don't want to talk about something which is upsetting you. And you decide to put it off. You just put it at the back of your mind. What is an example of that? You're mad with your mom, for example, but you can't tell her that at the family party or a social gathering. So you have to wait and save this for a time when you can speak to her privately. That is mature suppression of any individual if they want to deal with their defenses in a mature fashion. Which brings us to thinking right. And I left this blank, but I have 7 more slides to go. What do you think is thinking right mean? Now that I have told you and we have discussed what is leadership, what is counseling, what kind of defense mechanisms we tend to use. Thinking right means what? What will we do if we are saying we are thinking right? How would you say you are thinking right? Chaima, Chakana, I would like to add your thoughts on this slide of thinking right.
Okay, I'm just assuming that that's doing things in
Hmm.
moral. That's
Doing
doing
things
things in line with moral behavior.
in line with
Moral
Normal behavior.
behavior. Yes.
Moral behavior. Very good. What else is thinking right? I want your opinions, so I have kept this. Yes,
To my opinion,
Francis.
okay. I think thinking right is ability to accept other phenomena of life. You know, you may have a boring sibling. It is normal for a sibling to be boring. You may have a very talkative mother. It is normal for a mother to be talkative. You may have a boring classmate. It is normal for a classmate to be boring. So instead of focusing on them as negatives, you can start focusing on them as positive. Say people behave like this. So I think that's thinking right.
Very good. Focusing on positives. Very good. What else? I really need, because today is the last class, so we should have at least one slide made by you, which is thinking right. So I kept this. Thinking right. Very simple responses before I proceed. How else can we think right? All of you. Mariam, write in the chat. Ahmad is gone. Chakana, thinking right. Okay. Thinking right. Developing leadership qualities, thinking right, remaining positive, focusing on positives, ability to accept, doing things with moral behavior, taking responsibility. Can it be taking responsibility? Yes, Emmanuel. Very happy to hear your thoughts.
Yeah, I think to me thinking right it's making an informed decision over a certain situation that is at hand.
Exactly.
Um, you make an informed decision, but basing on the situation that is at hand at that particular
Right.
time, and also you
Right.
look at the place, the time, that area is whereby you
Right.
have to. It's whether that there can be further to thinking right.
Very good. Very good. Anybody else before I proceed? Thinking right. Excellent. So that brings us to mature defenses, which I just mentioned to you. Yesterday, we discussed defense mechanisms used by the ego when they are unable to deal with their problems. But I'm now talking about mature defenses like sublimation. Uncomfortable feelings or thoughts are transformed when a person chooses to take the energy behind these feelings and put it in a constructive manner. Like I said, I'm mad at my father, but yelling at him won't help. So I'm going to go out and paint. Yes, Francis, you want to say something?
Yes, ma'am. I was suggesting that may you put that projection at full screen. The font is just too small. We can't see.
Oh, God. 1 second. Full screen is not coming.
The screen is not coming. On your bottom, there is a cup like symbol.
Yeah. Uplight symbol is there.
Yes, if you
Now,
click it,
mature defense is coming full screen.
no, it's not. It's not.
Oh, because in my page it's coming. That's why I'm.
Madam, I think it's a full screen, but the problem is that the font that you have used to type is small. So I think there's nothing you can do, madam. It's just a mistake on the font.
Okay, I will read it out then.
All right,
Doesn't
let's
matter.
proceed.
Let's
Thank you.
proceed. Oh God, where did it go? Mature. I will read it out. I'll give you examples. So I'm just saying that suppose a situation is that I'm mad at my father, but instead of yelling at him because I can't yell at him, it is not acceptable behavior. I'll go out and paint a picture. I'll use my paints and paint a picture. The second example is I may be worried about dying of cancer. Sometimes somebody's having life threatening diseases, but I can't sit and worry about it. It's not helping. So you start helping in the kitchen, chopping vegetables, doing some vegetable gardening, because you want to minimize your fears of actually dying of cancer. So these are mature defense mechanisms. Altruism is another mature defense mechanism. It is a means of transforming uncomfortable feelings and thoughts by helping others. Sometimes we are going out as volunteers to help others. All that is altruistic behavior, and many times it is a mature defense mechanism. The third major defense mechanism is called distraction, a means of consciously deciding by putting off thinking feelings of distress. You are worried, you can't sleep because you are afraid of the examination tomorrow, but you distract yourself by doing something else, helping in the house, helping your younger brother or sister, and that enables you to deal with your feeling of distraction. Can you see the techniques used by a counselor to facilitate behavior change? This slide. The next slide, can you see?
No, ma'am, I think you have just stopped sharing the screen. You just check.
Oh, something has happened. 1 second. Okay, I will try again. This is, oh, it has stopped sharing. 1 second. Because the next few slides are fine. They are not small. This was the only one which was small. Yeah. Can you see these techniques used by a counselor to facilitate behavior change? There are 9
Yes,
techniques used by,
yes, we can see them.
yeah, there are 9 techniques used by a counselor to facilitate behavior change. I'm trying to see if I can use that bigger font because this is typed bigger. Consciousness raising, social liberation, emotional arousal, self reevaluation, commitment, countering, environmental control, rewards, and helping relationships. You need to read these techniques because there is a lot of technicality involved in this. And 20 minutes doesn't help me to complete, but I have used some keywords. Can you see the keywords? Cognitive therapy, arbitrary inference, selective abstractions. Can you see these keywords?
We can see them, ma'am.
Okay. So, cognitive therapy is a school of psychotherapy which elicits change in mood and behavior by identifying and altering faulty ways of thinking. The second keyword, which you will see in the module, is arbitrary inference, drawing unjustified conclusions. This can be a problem if a counselor does arbitrary inference and draws quick conclusions that previous cases were like this, so this case is also like this. What is selective abstractions? Focusing on one or two aspects instead of looking at the larger picture. These are the problems which the counselor may encounter. Overgeneralization means drawing of general conclusions based on limited events or limited knowledge of events. Excessive self blame, thoughts that assume more blame than is justified. And finally, scapegoat, which we discussed a while ago, thoughts that blame others more than is justified, and we take the blame. The last unit is practical issues involved in counseling. So, what are the practical arrangements? What are the difficult situations which can arise? And what are the problems we need to guard against? Handling difficult situations, 5 situations have been posed for us. What should a counselor do if the client finds it difficult to open up during therapy? What should a counselor do if there are silences during counseling sessions? What should a counselor do if a client begins to cry? What should a counselor do if a client shows inappropriate emotional reaction? And what should a counselor do if he or she does not know what to do? The $1,000,000 question. We will come to these questions in about 5 minutes as soon as I finish my slides. But I want you to think about which aspect of this you want to discuss. And what are the problems that a counselor needs to guard against? Flight into health, saying, oh, my client is fine, everything is resolved. In 3 sessions, I finished the case study. Transference, dependence, counter transference, resistance to the client's issues, external interference by a non professional, and omnipotence, showing that I am God Almighty, I can solve all your problems. All these are issues which the counselor needs to guard against. And finally, what are the practical issues which emerge in counseling? Summarizing what transpired in the previous session of counseling, discussing the behavioral outcome of the previous session with the client. Unless you make
But
good
can you
notes,
share the screen? This one is just stacking. I don't know what's the problem.
is it? 1 second, again I
Yeah.
will share. I thought that I am showing you the screen.
Oh,
Okay,
okay,
again I
fine.
will. 1 second, 1 second. Uh, I think that small font and big font was becoming the issue. 1 second, I will open that last. Is that last days? Yeah, today's that. There's some technicality involved in counseling. As I said, you need to study it uh, by reading the module after my class is over, otherwise, you will not be able to relate. Now, can you see practical issues involved in counseling? Unit 5. Can you see my
No.
screen?
Yes, 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 ma. Yes, ma.
Okay. Then, handling difficult situations. I raised 5 difficult situations which the counselor can be confronted with. Problems to guard against. I just narrated to you. Practical issues involved in counseling. Summarizing what transpired with the client in the previous session is important. We need to make notes in detail when we undertake counseling. Discussing the behavioral outcome of the previous session, possible only when we have interacted with the client in a professional way and kept track of the processes which have been going on. Reviewing the previous sessions if necessary with the client. Setting the agenda for the current session with the client. Proceeding scientifically and systematically with the current session. Summarizing the current session with the client, that this is what we discussed today, and setting a tentative agenda for the next session. These are all the practical issues which we need to be careful of. Now I'm giving you 15 minutes to discuss these 5 issues and any other questions which you may have. What should a counselor do if a client finds it difficult to open up? So I had asked you that if one of you will be the client and one of you will be the counselor, who is ready to be the client and the counselor? 10 minutes role play online. We have time for that. Francis, can you be the client? And Chakana can be counselor, or whichever way you want to do it.
I can volunteer to be the client, ma'am.
Very good. And who will be your counselor? Who can be his counselor? We will take any case which you wish to, based on your comfort level. And I have kept the difficult situations in front on the screen. Who is very ready to be the counselor for Francis? Francis is coming with a problem to the counselor
Just
online, but
yeah.
you need
Let, me- let,
to switch.
let,
Switch.
let me let, let me just volunteer. Then if anything you collect me, right?
Sorry.
Let me just volunteer to be a counselor.
Very good. But we need to switch on your video, Francis and Chakana. 10 minutes only.
Okay.
Yeah. So, Francis, it is up to you what problem you have come to the counselor with. And we are all observers, 18 observers. And later on, we will discuss what went right, what went wrong, how good a client you were, how good a counselor he was.
Good afternoon, sir.
Afternoon. How are you, sir?
I'm fine, thank you.
All right.
I've come to a clinic seeking help. I have problems taking my long life treatment, the ARVs.
Oh,
Um,
what? Oh, okay. So, how can I help you, sir?
I don't know. Sometimes I feel like taking them. Sometimes I feel like just stopping so that I should die quickly. But
Okay.
every time I stop, I suffer a lot. So I don't know what to do.
Okay. That's not an issue. All what you have to do is to maintain taking the drugs. Actually, if you stop taking the drugs, that's another issue. You know the complications of HIVs. If you're not taking it seriously, please don't do that. Okay, what I would rather to advise you is that uh, make sure that maybe you should have one to help you at home. Do you have a spouse, right?
No, I don't have right now.
You don't have. Okay.
Yes,
You need a guardian. There's supposed to be a home-based care whereby you're supposed to be receiving a treatment under guidance of someone at home. So what I would rather advise you, because you are alone, do you stay with anyone around you?
yes, I stay with my sisters and the little brother.
But whom will you confident? Whom will you have a confidence with?
At least I can talk to my sister sometimes. I do.
But what about your blood?
My brother is just too young. I don't want to involve him.
Okay. Your sister, are you comfortable with?
Yes, I do.
So you do anything, whatever it is. Right.
Yes, and she knows that I'm taking long life medicines.
Okay. Is she knows your status well?
Yes, she's the one who helped me to get a test in the first place.
Okay. That's nice. Okay. I would rather to meet with her, and you should come with her so that we should discuss some other few things whenever taking the drugs, right? But as of now, I would rather to advise you to follow these steps. Okay, in the morning you should wake up and drink the drugs, and you should take the pills of drugs, and then you should practice exercise. Okay, you should wake up, practice exercise. You shouldn't have that mind of that you are only one. Having HIV, that's not a solution to leave the drugs, or having HIV is just a beginning of a new life. All right. So this time around, which pills are you taking? Which
I'm
type of
I'm taking 13A.
13A? All right.
Yes.
I'll give you the same. So if you notice that there is no change, uh, just contact me. I'll give you my contact, and I'll visit you at home so that maybe you can talk some few things. All right.
All right. Thank you, son.
Thank you.
Thank you for your time.
Welcome.
Okay, this was a very easy counseling session. No conflict. The client gave all the information. Yeah, but sometimes we face difficulty in getting information from the client. Who will be that client for 5 minutes? Who might give counselor a challenge? Anas may not reveal all the thing, maybe not able to discuss so freely. That is also possible. That's why I closed my presentation with handling difficult situations. How well prepared are we in handling difficult situations? Handling difficult situations. Next one, who will be the client and who will be the counselor? Maybe a difficulty which I'm not able to express, and the counselor needs to devise some other ways of getting information. May not be as straightforward. Yes, possible. Such situations may arise. We had a very supportive client. That's very good, Francis and Chakana. Now we want to understand that suppose Ishak, Dente, Simba, would anyone like to be a client again? For 5 minutes, we have 10 minutes before we close for the day. Just to understand that counselor might have to adopt different techniques to get information from the client. What will we do in that case? How will we probe? How will we interview? Suppose the client becomes excessively emotional or dependent on me. Any thoughts on that? Any role play on that? Yes, Chakana, please go ahead.
Yeah, I can be maybe a client. I can be a
Yeah, but who
volunteer.
will be your counselor? Decide your counselor. Cliff, Dente, Emmanuel, whom do you want to select as your counselor? Simba?
Cadiero,
Again, you have to switch. Gadiero, can you switch on your audio, video? It's the last day, so let's do a little, you know,
Joanna.
let's do, Joanna, let's do, challenge ourselves. We spoke so much about being good leaders. Let's challenge ourselves at the end of the 6-day module so that when we are in the field, we can be effective social workers,
Oh,
effective
all right.
counselors.
Okay,
Excellent.
I'm
So
in.
so switch on your video, both of you, Chakana and Ivana. Very happy to see you volunteering. Please start.
How are you?
It's yours.
How are you, madam?
So I'll be the counselor or the
You
client?
be a you be a cancer.
I'll
Counselor.
be the counselor.
Yes.
Yes, ma'am.
Ah, all right, all right, all right. Okay, okay, let me start.
You can switch on your video. Is it possible?
No, I'd rather put it like this.
Okay, okay, no
I'm
problem.
not at a good
Chakana, your
place.
turn.
Yeah.
Okay, no problem. Chakana.
How are you, madam?
Good morning. I am fine. How about you? How are you today?
I'm alright, but sometimes you know, this world is not favoring men. I wish to die.
Oh, I'm sorry to hear about that. Would you like to talk about what's been bothering you?
It's a big story. Actually, to take time to talk. You know, I don't know what to do. Something's wrong in our house. Actually, last time I had the money, but now I'm bankrupt. Something just came in, and now I'm very poor. Life is not going well, and now I'm in bad debt. Uh, I don't know what to do because I'm a homeless person. I, I even don't have the friends now. Last time, but I had the friends, a lot of friends of them. We will talk. We have to share the ideas, but this time around, all of them they have scattered. I wish to die because I'm just living like an island, you know.
Oh, I'm so sorry about that, dear. I'm so sorry. It seems you have been going through a lot lately. I'm so sorry. But are you sure you don't want to talk about it? Because I'm here. I can help you. Are you sure you don't
Even
want to talk about it?
even my wife now that she leaves me with the kids. I'm just like the way I am. I don't know what to do because it's like I'm losing everything in our homes. You know, and the yesterday the 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 people came in my house and they collect all the stuffs which I had just because of the debts. And I was also just walking in the streets searching for jobs, knocking the doors, but nothing is working. I wish to hang up myself. I am not no longer be a person this world. I don't know why. I don't know why things is just coming like that.
Oh, that's really bad. That's really bad. But you have to understand that there are a lot of things going on in this life. That's
What
life.
what are they? Can you help me with this financial solution, or do you have anything to say about my situation? Because these things, I don't know the limit. I don't know what's going on to be happening. Do you really want to share with me any advice? Because things just coming in. It's better to forget this life.
I understand your situation. Are you working right now? Do you have a job?
As I said, that I'm just walking on the door, knocking the doors to find a job, but I'm just like the way I am. I didn't go far with the school as well. Actually, I don't know what's going on. I even seek the money to ask the relatives, but no one is giving me. Everyone is just giving me cold shoulders. I don't know what's problem. I wish maybe this life forget everything.
Oh, I understand you very well. I understand. But do you have any relative close to you? Maybe your brother, your mom, or anyone close to you that
Maybe
maybe they can help financially?
maybe only mom, but mom depend on me. So if mom eats today, it's just because I'm the one who supports him. So I don't know what to do. Do you really want to offer any financial solutions? I just seek that advice. What to do? I want to invest something. What should I do? How can I get money? What should I do to be like the human being? What should I do to become the way I was living last time? Because I said I'm bankrupt. Everything's not going well. I'm so disturbed in my life. Would you help me?
All right, I understand you very well, very well. But I am here to help you, but not financially. But I can help you how maybe you can survive. You can at least go out, maybe find a job, just find some pieceworks around. Maybe it can help you find some money so that you can be helped.
Okay, but you know the high level of unemployment and the way I live right now. I'm a homeless person. I need the support. Even at least I should have maybe the basic needs. I should have a food, cloth, and the shelter maybe because I'm just like the way I live. Do you have a learned about the theories of motivation? Have you learned the self actualization? What should I do? Would you help me, madam?
All right, where do you stay?
Currently, I'm staying in Blantyre, the seat of commercial seat of Blantyre, Dylan. Would you assist me, please? Would you assist me? Because now it's something like I haven't any relatives. I have no family. I have no place to live. I even I don't know what to eat today because I'm not working. I don't have any businesses.
All right. Would you
Oh,
mind if I come over to your place and talk about it?
no problem, please. You can come, please.
All right. Then you just hold on. I will make sure I come over there in the next 30 to 25 minutes so that we can see how we may help each other.
I wish to come because otherwise I don't see the 5 days living in this world. I wish
Don't
maybe to forget everything, whatever I'm doing.
don't worry. Everything is going to
Otherwise,
be all right. All
uh,
right? Everything is
so
going to be okay.
you see the way I live in. I'm just like I'm person, I'm homeless person. You know, I wish to search for the periods, maybe to forget this life, or else. Is there anything to help?
No, no,
Please,
no, no,
please,
no, no, no.
please help.
Don't worry. As I've already said, I'm coming over there. We will talk about it. Then we will see what we can do.
You know,
Okay?
you see, this life is uh, something like
I understand. Take heart. Take heart. I understand. Take heart.
it's
It's going
only
to be all right. It's going to
it's
be all
only
right.
it's only for the big shots who can enjoy this life. I don't know why God forget me. I don't know why I'm living this life. I don't know why I choose to live in this country. I don't know. I don't know.
All right, don't
I
worry.
don't.
I am coming over there, so you just have to hold on. You give me the map, and I'll be there. We will talk.
Possibly I'll be, but okay, fine. Because you have said you are coming,
Yes, you
I'll
just
I'll
have to
be
give me your address, then I'll be
I'll,
there in no time.
I'll,
I will
I'll
talk
be
to you.
wait, I'll be waiting. I'll be waiting for you patiently. But
Yes, I am
please,
coming.
could you assist me, please?
Yes, I will. I am
Life.
coming.
Oh, okay, fine.
All right, all right. Thank you, sweetheart.
Okay, that was a good attempt. We don't have time to discuss, but some issues were there. Yes, Chakana, you want to say something? Francis also raised some issue, but it was a good attempt, uh, at least to initiate you to counseling.
Yeah, it was a great one. The client was real. You could see the face, you see the expression, and the counselor was persistent. At least he kept on pushing, at least to help the client to open up. Although the client was repeating the same problem, but at least the counselor persisted. The very good part was that now the counselor made an attempt to meet in person with the client. That was positive. Thank you.
Definitely. Is Chakana, anything you want to say before we close? I'm only encouraging all of you to read the module, to give your best, and to become very good counselors and social workers. Any closing thoughts?
Uh, Thank you. This is wonderful counseling. I can see Joanna. She tried to defend herself. She's really sharing what the real life is supposed to be. Actually, online issues to castle with. I think these days it's challenge a bit because when you
Yes,
doing counseling physically, that's the best thing which you can do. So she decided
correct.
to come to visit me, to
Yes.
help me, so that maybe I should have a feeling of understanding to her.
Mm, mm,
So this is really appreciated.
mm. But unknowingly, she said, we will try and solve our problems. But she had to solve only your problem, not her problem.
Very true. Yeah, very true. Yeah, very true.
But
No,
very good.
no. I
No.
said I'll make sure we solve this problem together.
Okay, fine, fine. Okay,
Yeah.
good. And in our culture, I don't know about your culture, again, cultural context, you said, okay, sweetheart. In our context, if we say sweetheart to anyone, it will not be taken well. You may have said it in a friendly way in your culture. You know what I mean? So these things also matter. Suppose you are not in Africa, you're in India and counseling
Yes.
somebody.
Yeah,
It's possible.
I think even here some it brings a bad impression maybe to attract something like romantic like.
Uh-huh. So
Yes,
I hope.
whilst keeping social distance, I think as counselors we need to avoid such words. Sweetheart,
uh,
darling,
uh,
honey. Yeah, I think that was a slip of a tongue. I hope
yeah,
Joanne knows that.
I know it was slip of the tongue. So all the best to all of you, and I hope that sometime in the future, in the third next semester or any other time, we will meet again, depending on Dr. Panigrahi and Ignu. And I'm sad that many students miss the classes, and I hope that I can be in touch with all of you in some form or the other as you move along to BSW third year and MSW also. Hopefully, I think you will do. Is this your first batch of BSW from last year? Is this your first batch online?
Yes, yes. This is my first batch. I can't say
First
so
batch.
much.
Okay, so all the best. And Davis has written, I like where the counselor told the client the truth that she said she wasn't ready to financially support the client. That is a very good suggestion. Francis also asked that question that yes, we cannot make false promises to the client. That is very important. And counselor had a very pleasant way of communicating with the client. The tone of voice, waited for the client to finish, uh, there was consistency in her speaking to the client. All those were very positive features of the counselor. We hope we can all become good counselors like that. So again, all the best to you, and I hope that we will get another opportunity to meet again. Take care of yourselves, okay, and all the best for your future.
Thank you, ma. We are happy with your presentation. We wish you the
Thank
best.
you so much.
Thank
Thank
you,
you very much.
madam. Thank you.
Thank
Bye.
you. All the best. Bye. Bye. Bye.
Thank you, ma. Thank you, ma.
Thank you.
Thank
All
you.
the best. Thank you. Bye bye.
Yeah, ma. Thank you, ma. All the best.
Bye bye. All the best. Thank you. I'll close now, I think. With my turn didn't speak much, but thanks to all of you for participating. We can close now.